Welcome to Faevina, where care becomes healing. I'll be talking about why self-medication is more dangerous than you think. Self-medication may feel cheaper now, but it is often more expensive later. In Nigeria, many of us don't go to the hospital first. We go to the pharmacy. And let me be clear, I'm not judging you. This is our reality because of transport costs, hospital queues, bills. So we walk into a pharmacy and say, give me so drug. But as a nurse, I need to tell you something. Self-medication is more dangerous than we think. Let me tell you what I see as a nurse. I see people who did not mean harm. People who were just trying to feel better fast. People who trusted drugs because it worked the last time they used it. And that's where the problem starts. People often do this. You walk into a pharmacy and say, give me what I used last time. But here is the truth. Same symptoms do not always mean same illness. A headache today might be stress, high blood pressure, infection, or dehydration. It is not the same headache you had last year. Without examination, without diagnosis, you are guessing. And the body does not respond well to guesswork. Let us talk about antibiotics. In Nigeria, you can buy antibiotics easily. No test, no prescription. Then what happens? You feel better after 2 or 3 days and you stop. What you don't see is what is happening inside. Bacteria learning how to survive. Infection becoming resistant. Drugs no longer working when you really need them. This is why some illnesses become stubborn. This is not spiritual, this is not mysterious. It is just antibiotics resistance. Another quiet danger is mixing paracetamol with NSAIDs like diclofenac or ibuprofen, herbal mixtures, and alcohol all together. People don't realize the liver is struggling. The kidneys are overwhelmed. There may be no pain at first, no warning. Damage happens silently until it is serious. Pain relief can be deceptive. It hides ulcer, it hides infections, it hides high blood pressures, it hides gynecological issues. So you feel fine and delay care. By the time you reach the hospital, the condition is no longer simple. What could have been easy becomes complicated. I want you to know that every fever is not malaria. So don't go to the pharmacy and start asking people, I want anti-malaria, I want malaria drug because I'm feeling feverish. Sometimes it could be typhoid, urinary tract infection, or viral illness. Treating everything as malaria delays healing, and delay in medicine can be dangerous. If I were your nurse, I will tell you this: the body deserves proper diagnosis, not guesswork. Self-medication may feel cheaper now, but it is often more expensive later. These are what you should do instead. Use pharmacies for first aid advice, not for long-term treatment. Ask questions before buying drugs. Complete prescribed medication. Don't say, oh, I've used about 2 to 3 doses out of 5. I'm okay, I'm feeling better, let me keep it. Complete every prescribed drug. There's a reason why you are told to use it for 5 days. Know when to go to the hospital. Stop sharing drugs with family members. Don't say because, oh, this drug worked for me when I was having it the last time, or when I was feeling pain the last time. Use it, it will work for you. Stop sharing drugs with family members. Your body is not a trial and error experiment. Take care of your body early. It remembers how you treated it. Thank you for spending the moment with Faevina. Remember, your health is a journey, not a rush. Take care of your body. It is the only place you live. See you next time.